Hey, Dr. Lindsey and Wendy here. This is a brief video on a repair case that we did about 15 or 16 months ago. And this is a big fellow who came in from out of state, who'd had a low yield transplant at a production line type hair transplant office.
A big company.
Big company. And then he came in with his wife, who's a nurse, and we had a big sit down talk, and we decided we'd do a strip on him. And so here he is, where we started, and we took a strip out of the back of his head, and I think you said we got somewhere around 2,200 grafts.
200, yeah.
Partly because we're cutting out his old scar, and partly because he wasn't as dense as some people, and partly because his scalp was stretched from his previous work.
Yeah.
And so we put that in, and then I do my best in all these videos to try to beat it into people that they got to keep my head clean during the first week, or the crust will build up and pull out our hair. And his wife, being a nurse, and she's kind of a tough lady. She
but he's
we left it up to her, and he did a crappy job cleaning.
Yeah.
And so here's what he looks like. And that's awful looking.
Yeah.
Gross. And so almost certainly that crust gets so adherent to each hair that eventually when things start pulling out, it pulls the root out. And
yeah, I get a lot of questions like, why you guys are so big on cleaning? And I tell them that you're pretty good at taking, take crappy pictures, but you're pretty good at documenting everything. And we have seen that people that clean the best and looks really, really clean. I mean, they
typically grow better.
Really good, yeah.
And so he came back at a year, and he looked pretty good. He and his wife were happy, but I'm sure that crappy cleaning pulled out some of the grafts. And so he did this little video in which we talk about him. He's quit smoking. And I'm giving him $1,000 off his second surgery because he's quit smoking. I know that smoking affects the revascularization, or blood vessels growing into those hairs. And so he cut down from 2.5 packs a day to 0 packs. And I just know it's going to work better. And so he did this little video. So take a look. Okay, Steve, I worked on you a year ago, and I got your before picture up to one side of you. And I got Mrs. Steve. Was that pretty upfront with you when you came in?
Yes, very.
Absolutely.
You had some work done elsewhere, don't say where it is, and was more straightforward and didn't give you the runaround?
No.
No,
Okay.
definitely not.
And the thing I wanted to have Mrs. Steve in for is I told you to quit smoking because I'm completely convinced that smoking affects how hair grows, at least in the early stage. And wife, you said he quit smoking.
Yep.
So we will give you $500 off your second case as a result of that. All right.
All right.
Anything you want to tell any of these guys that are watching this?
Only thing I could say is I've been to several other places, and one place actually had a procedure, and as far as Dr. Lindsey goes, he was the most straightforward, and from the work I've seen in the past, everything has looked upfront and proper and the way I thought it was going to be done, and that's how it was done on me. So
And we're very happy with the results.
Happy with the results, and I appreciate it.
All right, thanks a lot. And so then he came back 3 weeks after we did that video, and we did a case on him, and we took his old scar out and added a few hairs to his hairline, and then worked behind it. And again, sent him out of here with instructions to do good cleaning, and they did a great job this time.
Yeah.
And
Yeah, they did. He did.
Yeah, so this is a picture that his wife sent in at day 7, and compare that to the crappy cleaning. And while it's pretty early in the follow-up, it's only been about a month since we did this. I just know that 13 months or 12 months from now, that second case is going to have grown better than the first case.
Yeah.
So a couple things. Do your research. Make sure you know what you're getting yourself into before you sign up with the chop shop, like this fellow did the first time. Second is do good cleaning, or do whatever cleaning your doctor wants you to do. If you're coming here, we got lots of videos, and we'll be glad to help you every day if you want to. And 3 is be patient. It takes a year and 2 or 3 months for this transplants to grow in, and just be patient, and typically it works out well if you do your research. Anything you want to add?
No.
Okay. All right, that's a first.
Aye.
we can help you. Give us a call.